Well, imagine being born without an ear. You're probably deaf on that side. People may stare or make fun. That's a situation a little Arizona boy found himself in. But now some generous New Yorkers are going to change his life.
Oh, my goodness.
Edmund Hobbs, Eddie to his friends, is a very active, fun-loving, and obviously very cute 6-year-old. Doesn't look like there's a thing in the world wrong with him until you look under his curly blonde hair and notice Eddie was born without an ear on his left side.
He's not shy at all about his ear, and it makes him a little more compassionate towards other kids. He's become a very giving person.
It's called microtia, literally small ear, a spontaneous birth defect that has nothing to do with anything mom did during pregnancy.
There's a million births in the United States a year, so there are anywhere from several hundred of these children that are born just in the United States every year.
That's why Eddie and his mother have traveled all the way to New York from their home in Winslow, Arizona, to see Dr. Thomas Romo, an expert in ear reconstruction.
We're going to put the framework in here to match this frame auricle here, and let that heal up.
Reconstruction usually means the painful removal of a large piece of rib cartilage to create an ear over a half-dozen operations. But Dr. Romo has worked out a way to use something called porous polyethylene, essentially a biocompatible framework for skin to grow over.
Because it's porous, the body grows into it, it's 50% porous, and so it tends to fight infection well when it's exposed.
Eddie didn't talk much about his ear today until he drew a picture of his favorite monster, Godzilla.
He just has 2 ears like you.
In the Hopi way, when someone's born different like that, he's very special. He's considered to be a very special, unique person. He's very popular amongst our people because he was born that way.
Now, as you gathered there, Eddie and his parents are Native Americans from the Hopi Indian tribe. Now, Eddie will need only 2 operations instead of the 6. It's the conventional reconstruction. The first, an outpatient procedure this Wednesday, and we'll be there to bring it to you. Then 8 weeks later, some finishing touches on the ear and the implantation of a special hearing aid that will restore Eddie's hearing on his left side. And all of this is being covered by the Little Baby Face Foundation, which Dr. Romo started to help kids with facial deformities. And here, Sue, this is the little white plastic porous polyethylene. This is a framework that they will drape skin and fascia and some things over and blood supply over, and the skin will then cover this, grow into it, kind of shrink wrap down into it, and over a period of a couple of months will start to look like a normal ear.
Well, this is just like a miracle. Yeah. It's a miracle. He'll have most of his hearing?
Well, he will after he doesn't have any ear canal in there, no middle ear, none of the little bones or eardrums or anything in there. So they're going to actually put a small, like titanium screw in here, put in a special hearing aid that will restore the hearing on that. We'll describe more of that on Wednesday for you.
It's exciting stuff, Dr. Max. Thank you.
Well, Monday we told you about a little boy who's come all the way to New York from his home in Winslow, Arizona, to have a new ear surgically constructed. Usually this means several painful, risky operations using a piece of rib. Now there's a better way for Eddie Hobbs.
Even though it doesn't look like he realizes it, this is a big day for little Eddie Hobbs, a day that will change his life. You see, the 6-year-old Hopi Native American boy was born without his left ear. But earlier, his mother told me the missing ear hasn't slowed Eddie down a bit.
He's very bright. He's very active. He's not shy at all about his ear. And it makes him a little more compassionate towards other kids.
Now that it's time for Eddie to be anesthetized, though, it's clear that he's a lot less anxious than Mom. Finally, Eddie falls asleep, and the reality of what's about to happen overwhelms Mom.
That was real rough, seeing him fall asleep like that. The hardest part is up to him and the gods. He's in the hands of the gods now.
Dr. Thomas Romo is the surgeon who devised this reconstructive technique. But before the first cut is ever made, there's a lot of planning, measuring, and copying of the ear Eddie does have.
If we create a nice, perfect little ear for him, but we have it in the wrong position, it still will not be a success.
Doppler ultrasound maps out the tiny artery in the membrane that will be the key to the survival of Eddie's new ear. Then it's time to cut. 2 other surgeons take skin grafts from Eddie's upper thighs while Dr. Romo begins the painstaking process of dissecting out the tissue that will cover and nourish the ear. Next is the artistic part, carving the prosthetic ear to match Eddie's. It's a special type of polyethylene.
You can almost see that it's porous, and you can almost see through it in spots. And so what happens is the soft tissue grows into this.
Dr. Romo makes a pocket under the skin to insert the plastic ear after draping it with the artery-carrying membrane, then covers the top of the ear with the skin grafts. 3 hours from start to finish.
It looks great. The contour came out great, and we're just hoping to see it survive.
But most importantly is the mother and son reunion. Just a few minutes later, Sandra sees Eddie in recovery. But Mom will have to wait till tomorrow to see what his new ear looks like.
As long as he likes it, I'll be fine with it.
Good.
Now, Eddie will only spend tonight in the hospital. In about 10 days, he'll be back in Arizona. In 8 weeks, he'll be back for an earlobe and a special hearing aid, all donated by the Little Babyface Foundation and Angel Flights, who flew Sandra and Eddie to New York. And it didn't look quite normal, but over the next few days, that skin will shrink wrap kind of and suck back down onto the ear, so it'll look very much like his other ear.
All right, Dr. Max, thank you. That's wonderful.
News for your health. The bandages are coming off a 6-year-old boy's artificial ear.
It's a great story. Let's get the latest, yeah.
Karen and Jim, last week, we told you the story of a 6-year-old Hopi Native American boy who was born without an ear. But thanks to a New York foundation, he got a new ear, and today we saw what it looks like, which may still be a little raw for some viewers.
It's a big day for little Edmund Hobbs, Eddie to his buddies. It's the unveiling of his new ear. To most people, it may look a little rough still, but to Mom, it's a work of art.
I think it's amazingly beautiful.
Remember what Eddie started out with. It's called microtia, a birth defect that meant he was born without his left ear. Normally, reconstruction involves a half-dozen painful operations, but Dr. Thomas Romo has developed a procedure that uses a porous polyethylene framework that allows Eddie's own tissues to grow and form his new ear.
This will shrink back in and give him the contour. You can see this by pushing on it. I make it go in. And the body will, over the next 6 months, bring that in, and the color here will pink up.
That pink color is probably the best news of all for Dr. Romo.
Skin grafts are taking blood supply, and he goes home in 2 days, and I think he's going to do great.
And even though the reconstruction required some pretty extensive incisions, Eddie told me it doesn't hurt.
It feels invisible.
How come invisible?
Because I don't feel it. It turns invisible if I touch it.
But it doesn't hurt either?
No.
All of this has been donated by the Little Babyface Foundation and Angel Flights, which has Eddie's mom saying this about New Yorkers.
New York people are nice. They're not grumpy. They're not grouchy. You know, they gave you a bad rap.
See, we're okay. Now, remember, that was just 8 days after Eddie's surgery. Eddie and Mom will be back in 8 weeks to give him an earlobe and an implantable hearing aid. Then he'll have an ear and hearing where he used to have none. Isn't that a nice story?
It is just amazing.
And they're taking care of him. Everything's been taken care of for him, and they're going back to Arizona Saturday morning.
Clearly, though, Mom has not seen you on a bad day.
Yeah, great, because you're still grouchy and wondering.
Yeah, well, that happens to all of us.
Our producer's going to get grouchy if we don't say good night.
Right,
That's it for Live at 5. Thanks for joining us.
And now here's Chuck Scarborough and Linda Vaccaro with News Channel.